Well, for more on this, we'll cross now to our Berlin correspondent, Nick Spicer. Nick, what are some of the restrictions that officials are considering?
Well, one of the things, and he'll be present during this conversation, is a mandatory vaccination. Olaf Scholz, he's the incoming chancellor. Angela Merkel is still in power in a caretaker capacity. She's bringing along the next expected chancellor, who will be voted in next week, Olaf Scholz. And he has said he would like to have Parliament vote on mandatory vaccines in February. Personally, he was going to be voting for. He went on TV last night saying the big fault line in Germany is now not between the old and the young, but between the vaccinated and unvaccinated. And he appealed to Germans in a comedy show, actually. He sat and talked to the camera for 15 minutes. It was quite extraordinary to get vaccinated. Now, the other measures, they're going to be talking this morning, local time. The 16 regional governors will include banning people who would have not been vaccinated or overcome COVID from restaurants, cinemas, restaurants. They won't be allowed to go into such places, making the wearing of a mask mandatory in schools across Germany, limiting the number of people who can gather indoors to 5,000. I know that sounds like a lot, but they will have social distancing, and equally making sure that the vaccination rollout, which was accelerated before Christmas, increases, because we only have about 69% of people vaccinated here in Germany, relatively low compared to some other countries.
And the cases in Germany have been kind of surging for several weeks now. Why has it been so hard to make a decision on new restrictions?
Well, one of the reasons is the situation I just evoked. We have a caretaker government, sort of a cohabitation between Angela Merkel in power for 16 years and Olaf Scholz, Social Democrat. So they need to sort of get their ducks in a row. And also there's a federal structure of Germany. We have 16 health ministers. There's 16 premiers who are joining the discussion, but 16 health ministers. So throughout the entire pandemic, there's been a patchwork of regulations. There have been national measures. There was a national emergency situation which was created, but that was lifted on the 25th of November. So what it looks like, what's happening now is a similar type legislative framework and policy agenda that's being developed, but they're kind of going back, to get things back in motion. It looks like they're taking more say draconian measures, possibly calling for a vaccine mandate, as is the case in Austria in the beginning of the year. But they're just getting back up on their feet, if you will.
All right, Nick. Well, thank you for the latest there out of Berlin.